The stories shared on It Takes Balls are unique to the individual sharing. Always speak with your trusted medical provider for treatment options specific to you. Welcome back to It Takes Balls, presented by Testicular Cancer Awareness Foundation. You know, we're finally in Testicular Cancer Awareness Month, so if you want to run a fundraiser, Testicular Cancer Awareness Foundation would greatly appreciate that. But today I'm joined by a survivor, Trent Melsheimer. Thank you so much for being here.
Thanks, Steven. It's a pleasure to be here.
So before we hop into your testicular cancer story, tell me a little bit about who you are.
Yeah, sure. So I'm a 28-year-old guy living in Denver, Colorado right now. Been living here more or less for about 4 or 5 years. I'm working at an aerospace defense company. Got a bunch of good friends out here that like to do things like snowboarding, camping, hiking. Some of them go mountain biking, things like that. So yeah, that's kind of been most of my story, except for obviously what we're going to get into today.
Yeah, so let's get into it. So tell me about you noticed yours like right before you were a best man at your friend's wedding. So tell me about that.
Yeah. So there was kind of like, um, I had some symptoms leading up to it, but I kept attributing them to things that ended up, not being true. So yeah, my best friend since like we were 3 years old was getting married like the weekend after I got diagnosed. And leading up to that, I was like having some back pain, some lower back pain. It just so happened that I like had a couple of herniated discs. So I had like back surgery like a year before. So back pain was quickly attributed to that. And then it like kind of evolved into stomach pain. And I remember thinking like, oh, worst case, it's like stomach ulcers or something like that, which obviously turned out to not be true. So I kind of worked my way up the chain with like getting medical help. So I started with like a telehealth appointment, then I went to my PCP, and then I went to urgent care. And they gave me like really strong antibiotics because they thought it might have been like a parasite. And at the time, I'm kind of like, hey, my best friend's getting married across the country. I need a quick fix just to get me by, kind of thing. But then it got like pretty unbearable, like a few days before his wedding. And, I kind of had been roughing it for like 2 or 3 months, attributing it to all these different things, never thinking that testicular cancer could be the cause of the symptoms. But my brother kind of convinced me, like, hey, you should just take yourself to the ER, like, worst case, you feel a little guilty in a sense. I feel like sometimes I had like some imposter syndrome about going to the ER, that like it's just for people who have like really serious, obvious things going on. But he convinced me, so I went. And yeah, they basically were doing a lot of tests, like asking me a lot of different questions, trying to figure out what was going on. And then like I remember seeing like the physician's assistant's expression of like concern through the window, and then she was calling for a doctor, and then shortly after, her and like a doctor kind of came in looking pretty serious, and basically, yeah, told me I had cancer. They're going to run some more tests, but they had seen a tumor in one of my CT scans. So obviously that was a pretty big shock at the time. Again, I was going into the ER like, I probably shouldn't be here, but I just want a quick fix to be at my best friend's wedding. But now I'm getting told I have cancer. So yeah, that was kind of a shock. I remember originally like looking up, because it took them a little bit to, kind of figure out that it was testicular cancer. I got an ultrasound on my testicles after that, and that's when they kind of figured out the source. But I didn't know anything about cancer at the time, so I'm like, okay, it must be stomach cancer, because that's where they found the tumor. And I'm looking up, I'm already looking up probabilities and all these things, and I was actually kind of relieved to find out it's testicular cancer, because I think I had heard or known before that I guess it's one of the more favorable options, I guess, if you had to pick. So yeah, that we kind of progressed from there, and I think I like incrementally. Like at first, like I said, I thought it might have been a death sentence. Then I was kind of relieved, oh, just testicular cancer. But then I kind of incrementally realized maybe like how serious that was. Like I remember at first asking, like, oh, can I still go to my best friend's wedding? And they were like, I think legally they're not really allowed to tell you no, but they were like, I want to do that, and I was like, okay, this is yeah, this isn't something I can just kind of rough out.
So did you go?
No, I didn't, and thank God I didn't because I ended up getting my orchiectomy. Like, I was put in the wait list for like emergency surgery, got my orchiectomy. So they took my left testicle out. And then I
Was it
was
the
still
same day you went
having,
to the ER?
yeah, it was that. I went like at, like after work because yeah, it was, I think I was having a hard time working that day. I went like, like 3 o'clock or something like that. And then by like 5 or 6 a.m. the next morning, they had the orchiectomy. Then eventually I got let out and my stomach pain just like, and we'll probably talk about this too, because I think it was spreading like relatively fast and my stomach pain just started like accelerating like crazy to the point where like I ended up going back to the ER after my orchiectomy because I was just having like crazy stomach pain. I remember I walked into the ER room, like the main area in the front, and then like had to sprint to the bathroom because I was puking because I was having so much pain. So yeah, it was for the best. As much as I wanted to be at my best friend's wedding, he was pretty understanding, and I still gave my best man speech over FaceTime to him that night. I'm pretty sure. So it was for the best that I did go for sure.
Yeah. So, I mean, so you mentioned you had your CT scan first, and that was because of the stomach pain. That's interesting.
Yeah, they kind of were like, let's start there. Because I think they were like feeling around in my abdomen a little bit. It's actually kind of funny. So I mentioned back pain. I was like also doing something called like muscle activation technique. It was like a certain kind of physical therapy my surgeon had recommended. And my stomach was just like really like rock. Like I think I had like a sweet potato sized like tumor in there. So like relatively large tumor, I guess. And so it was kind of like solid, my stomach. And I think the doctors were feeling around there, hence why they did the scans. But my physical therapist was actually like pushing around there. And I remember him telling me like, "Hey, stop flexing your abdomen so I can like massage it out or whatever." And I was like, "I'm not flexing." Like, and he's like, "Yeah, you are." I was like, "No, I swear I'm not." And it turned out he was pushing on the tumor the whole time. Um, so yeah, I think that's why they try to troubleshoot the CT scan first, and then they kind of, I guess, followed the metastasis down to the testicles, and they found the root cause. And it was strange because like my ultrasound, I think my left testicle, I did notice like my left testicle, I remember like feeling weird when I was in the shower like a few weeks before. Never occurred to me to correlate that to what I was dealing with. I remember thinking like, oh, I'll deal with that later, that was actually what I needed to deal with then. But yeah, it was only like 3 cubic centimeters larger than my right, which I thought was kind of interesting because I feel like some of the nurses and PAs were telling me that like some guys come in with like a grapefruit sized testicle, and it's like pretty apparent. Whereas for me, even though it had spread quite a bit, it was relatively small testicle size.
I'm assuming you had like a CT or an MRI or something before your back surgery. Like what was the timeline between and was there any evidence of it on the scans before?
That was actually like one of the first things I wondered, because I actually had an MRI on my lumbar, um, pretty like my lumbar back pretty like soon before. I think it was in June of 22, and my diagnosis was September of 22. So I would imagine, there was a tumor in there. I actually like brought that up to somebody. I forget if it was one of the spine surgeons or one of the doctors, but they basically were like, it wouldn't have shown up in the lumbar MRI. So I kind of just accepted that logic. I don't know for sure if like the radiologist theoretically could have or should have caught that, but I think that abdomen, the like CT of the abdomen, is like a different kind of view and angle of the spine MRI, or maybe they just weren't looking for that specifically. So I would imagine though, like something probably did pop up there. It just probably wasn't as apparent because they weren't looking for it.
Gotcha. All right. So after MRI or after the orchiectomy, you had more tests, and I know you said that your tumor markers were really high.
yeah, that's kind of when, like I said, like incrementally, I kind of realized like how I guess like serious things kind of were. So, um, I did get an MRI of my brain, and luckily that came out clear. So at this point, all I kind of know is that I have testicular cancer that spread to my abdomen. They got the root cause out, so I had my orchiectomy, and they were like, "Yeah, come back and like." And I will say, like the hospital I went to was really great about like diagnosing everything. Like I've heard some horror stories about that. So luckily, like that was all smooth. But they did say like, "Oh, just come back in like 2 or 3 weeks, and we'll start chemo." So at this point, I'm kind of like, okay, like time's not like a huge kind of issue, I guess. But then I start doing research on my own once I get home from the hospital after the second time at the hospital, as I just described. And I was looking at like my tumor markers, and I think my AFP and what is it? Is LDH the second one or the one of them? I think it's LDH.
LDH and HCG and
Yeah. So
AFP.
yeah. So the AFP and the LDH were my AFP was high, but nothing like crazy. My LDH I actually think was normal. And the HCG was like 181,000 from when I was pre-orchiectomy. And I remember thinking like that comma looks like it should be a decimal point. Like that looks like orders of magnitude off. And then that's when I discovered Testicular Cancer Reddit. So shout out to that forum, because that's when I basically posted like, "Hey, like, what should I do here?" Like, I just found out myself that and maybe they weren't trying to freak me out or anything, but like, this seems like kind of um, concerning, I guess, because like I think I had read like even a HCG of 100 or like definitely 1,000 like isn't really a great thing to have. So once I started seeing past 100,000, I was like, okay, this is kind of crazy. So two people like responded really quickly and basically just said, talk to Dr. Einhorn. And I'm like, okay, who's this Dr. Einhorn guy? And obviously, a lot of people on your podcast, I've listened to your podcast a bunch through chemo. So, Dr. Einhorn's the man, the myth, the legend. And I reached out to him at like midnight or something. And on my way to banking sperm the next morning, he called me. So he like called me back right away, which was I thought pretty surprising considering how much I had read about the guy. He basically was talking to me, and I was like expressing my concerns that I put on my Reddit post, basically that my HCG was really high, and was also explaining to him like, oh, after the orchiectomy, they were like, yeah, give it a couple, 2 or 3 weeks to like heal or whatever, and then we'll start chemo. And he was basically like, no, like you kind of needed to start chemo yesterday. Like, how soon can you fly out to Indianapolis, kind of thing. And I was like, as soon as tomorrow, basically. So yeah, I booked a flight and flew out there and did my first of 4 rounds of BEP in Indianapolis. My mom came in with me, which was awesome. And then eventually, I went to my parents' place to finish up, I think, rounds 3 and 4, and my girlfriend visited me down there. But for a while, I was in Indianapolis. For my first round was inpatient, just that was their backdoor way of getting me in the door, basically, to start chemo like immediately. But then I started doing outpatient there, and I was staying at a nonprofit, Fairhaven, out in Indianapolis. They actually have had a lot of testicular cancer patients stay there, which is pretty cool. So yeah, that was basically it. And this was all I ended up being in Indianapolis for a lot longer than I was supposed to, because the plan was to eventually bring me to Florida to finish up my regimen, just so I could be with family and whatnot there. And it turned out, I forget which hurricane, but there was a hurricane going on in Florida at the time. So I was in Indianapolis, I think, for like 6 weeks, and I eventually did go back for my RPLND. But yeah, I was there for quite a bit at the time. But all the people there are like super great, so it wasn't a bad experience.
So the hospital that you first like had your orchiectomy at, was that just like a small local hospital and they just didn't have the experience?
Yeah, it was a hospital in Denver. Yep. So that was kind of like you said, like didn't have the experience. I think they had a decent amount of experience with diagnosis. I think I remember asking. I had a physician assistant there, Ian McComb, I think was his name. And he was like super great. Like when I got diagnosed, he was like, "You're my job today." So he hung out with me the whole time, described everything. And he was like, "Yeah, we typically get like one a month of a testicular cancer patient," which in retrospect actually feels like kind of high because I know it's like not super common, but I guess Denver's a fairly large city. But to your point, like, as I kind of got into the Dr. Einhorn system of things, I realized how much, and then had a really great oncologist in Florida. Even he like was also not super like spun up on testicular cancer. So I kind of realized how much I feel like, at least from my experience, like IU, Indianapolis is like, they just have the most knowledge. So I think it's pretty cool that it seems like Dr. Einhorn like spends a lot of his time like teaching as opposed to treating, just so he can kind of spread awareness a little bit more, especially with like treatment options and whatnot too.
Yeah, and that's pretty cool. You got a call. I mean, maybe not a good sign at the time, but to get a call back is kind of cool from the legend.
Yeah, no, and I actually I ended up meeting him on his 80th birthday. So they had this huge event for him because obviously at IU, like even beyond the testicular cancer world at Indiana University Health, he's like big figure there. I think he's a large contributor of the success there from the earlier days. So I was like starstruck when I met him too, because I was like, oh my God, this guy like cured Lance Armstrong. This is crazy. But he, didn't even realize it was his 80th birthday until after our appointment. And I was reading about it in like testicular cancer Reddit or something. So he's just like a real down to earth guy. I like joke that like he gave me the vibe over the phone because we were talking about insurance at one point, and he was like, we'll figure that out later. Like I just got the sense from him that he's like, I would treat people in my basement if I had to. Like he just wants to help people. So he's a pretty great guy.
Yeah, it's funny you mentioned being starstruck because like it's funny like I would like to be friends with Harry Styles, but I also want to be friends with my doctor. Like I keep trying to go golfing with my oncologist, and I think there's probably rules against that, but
Yeah, there might be a conflict of interest there or something.
maybe
Never
one
got a
day.
beer with him, but
All right, so tell me about like your chemo experience. Where you said Dr. Einhorn kind of does more teaching than treating. So were you like under Dr. Nabil Adra, or who were you seeing?
yeah, it was a lot of working with Dr. Adra. Also Jay Uti or you, his nurse. I grew like kind of close to Jay, and my mom and Jay became friends, and Jay was like around a lot just for like the day to day kind of questions because he's like actually he's super knowledgeable on those things. So and Dr. Adra of course is great. So a lot of like the visits were typically from them. Jay more frequently, Dr. Adger maybe every couple of days, and then Dr. Einhorn maybe once a week when I was inpatient. But now, I still do surveillance with Dr. Einhorn like every few months, just to kind of keep a pulse on things and do blood work and whatnot. But yeah, the chemo experience, yeah, it's like a slippery slope. Like I think the first round I remember thinking like, oh, this isn't so bad. And my company was like actually super great and supportive during all this. And I remember being like, oh man, maybe I should be like trying to work a little bit, like if this is how chemo is going to go. And then the hair starts falling out, and I'm sure you can relate. And then all of a sudden, I think it really started hitting like the third round. I had like a selfie in the mirror on my last day of chemo, just so I never forgot how brutal that was. Because yeah, I mean, it feels like it's just sucking the life out of you. I couldn't imagine doing. I mean, I don't know many people that do a fifth BEP round, but I couldn't imagine. I mean, that'd be a really, really hard thing to get through. And my biggest challenge was actually, so for a while, it was kind of the only thing I like maybe debatably would disagree with on Dr. Einhorn until something that happened later that we'll talk about. But I remember he was really adamant against the port because just the risk of infection of having a port, and basically, or a PIC line, I guess was another option. But what happened was like I used to have a decent amount of veins in my arms, and like even now I barely have any because my vein just like shriveled up, and like it was getting to the point where I think I counted like one time it took them like 12 tries to get something in, and I found when they had to put an IV in, that's when it's hard. When they're taking blood out, like typically that's not super difficult, but getting the IV in for me was like a super big pain. And yeah, I remember like the whole time I was like, oh man, I wish I just got that port. But eventually, after my whole chemo experience and RPLD, I ended up getting like a really massive infection because I had a drain put in where my tumor was, and there was a bunch of liquid buildup. So I ended up like having like a septic infection, was in the hospital for a week. So looking back on that experience, like I mean, if I got a septic infection during chemotherapy, that could have been it. So
Yeah.
I now I know why Dr. Einhorn says even with all the how much of a pain it is not having a port. And I even had to get like a blood transfusion one time, and I had to like tap out halfway through because like again putting stuff in was just I mean, I hurt so bad. I got through one bag and I was like, I'm done. But it was all worth it because you just never know. And I feel like just having that, like being sanitary during chemo. I remember my parents were like really strict. Like anytime we had food, like even like vegetables, like always had to be cooked, or like anytime there was food coming from out of the house, like we would put it in the toaster oven for a while just in case, kind of thing. Because something I didn't think about until it happened, basically. But
Yeah.
yeah.
You said a couple of things there that I want to expand on. First, so you did 4 times PEP. Did you have lung metastasis?
Yeah, I did. Yeah, I actually forgot about that. So there was like a few actually I think it was like 8 like dime or quarter size. I think the largest was like a quarter size little tumors in my lungs. Fortunately for me, we kind of caught things when it did, because I didn't mention too, by the time I got to Indianapolis, which was only about a week after my original HCG markers, it doubled to 360. So things were definitely spreading like kind of in real time, but luckily we caught it right as it was probably starting to enter the lungs, I'm guessing. So, and Dr. Einhorn, it was refreshing because he kind of assured me from the beginning, like, oh, chemo is going to wipe that out. And that turned out to be true. I think I had like some scar tissue and I got x-rays and stuff in there. But we never had to do like any surgical type stuff in the lungs, which I'm super grateful for because, I think I heard that you've had the RPLND, doing that and then having another surgery on top of that after many rounds of, I mean, that'd be pretty tough. So luckily it did what he said was true, and I didn't have to worry about those anymore.
Yeah. And then the other thing I wanted to ask about was the blood transfusion. I think you might be the first I've talked to who had a blood transfusion. So what was that like?
Yeah, that was like I said, it was pretty difficult for me. And what basically the order of operations was, I went in to get blood work, I think before one of my chemotherapies. It might have been my glio day, so like the bleomycin day where they just kind of takes 10 minutes basically, and then they just hydrate you and you're out. And they noticed my white blood count was like, again, getting back to like infection risk and stuff, it was like really low. And in addition to that, my red blood count was like concerningly low too. So and I remember like even just like getting up from bed every day, I couldn't get up too too fast or I'd faint. So I was losing a lot of blood, just I guess from the chemotherapy. I think it like affects your bone marrow and all that. So yeah, I basically I remember being there, and the guy Randy that would like typically do all the testing before I got chemo was like, "Hey, you're gonna have to like get a blood transfusion." So I remember the oncologist there. He really didn't, sometimes people would like mess up your chemo regimen because of that risk, but I think Dr. Newman worked with Dr. Einhorn, and basically Dr. Newman, my oncologist in Florida, did not want to stray from Dr. Einhorn's orders, basically. So he was like, "Hey, we're still going to do today's chemo, but we got to get you on blood transfusion." I think it was lucky timing where I had like a weekend or something before my next chemo regimen, so I had like 2 days to like get a blood transfusion before my next. I basically can't have like too low blood if you're getting chemo. That would be, I think, dangerous. So So yeah, I got a blood transfusion, and yeah, it was a tough experience. I think for me because I was already having so many vein problems. So I mean, I remember I was just like in pain, like on my wrist and hand where they were putting it in because I had no arm veins anymore, so they're putting the needle through my hand, and I'm just sitting there. I mean, it was like 4 hours, I think, and I'm just like trying to last as long as I can through the pain. And I got about halfway. I got through the first bag, and basically, I kind of knew in my head how much they were going to give me, and there was a level of margin there. Um, so I got like a little bit past what I actually needed, and then it was like I'm calling it. So luckily, it was enough. But yeah, it was a tough experience, but I did actually feel rejuvenated after. So it was, I guess in the long term, it was pretty nice to have.
What's your type?
I forget already. I actually remember I got tested for my type, and I was like, I feel like I should know this for the future, and here I am. Is it like OA or something? Is that there's like A and
There's
double A?
A, B, and O, and then I think there's some other like random variations of it, but I'm not sure.
Yeah.
I'm A negative.
Okay. All right. Good to know. Yeah. Yeah. There's like weird combinations you can do, like too, like where something works with some people, but it doesn't go like the other direction or something weird like that. So I was like compatible with something that wasn't technically my type or something like that. So luckily, yeah, I actually remember feeling bad. Like I was like, I don't want to start this second bag because somebody donated a bunch of blood. So like I didn't want to go any of it to go to waste.
So
Um,
when you're getting your infusions in like your hands and stuff, I mean, how does that affect when you're sitting there all day, your ability to kind of play on your phone or watch a movie on an iPad or something?
yeah, you got to be pretty careful. Like I was pretty much I learned because that was another thing that kept happening. Like especially I've had various experiences where I've had to stay overnight at the hospital for one reason or the other, and like a lot of times the IVs pop out. So yeah, the key is just staying like as still as possible. So I pretty much whatever hand it was, I was stationary because I learned that lesson. I remember on a couple of occasions where I'm like, I'm trying to fiddle around with my iPad because you're sitting there for 8 hours, and next thing you know, your IV pops out and your thing starts beeping, and now you gotta do the whole process over again. And it sounds like not super bad when you're like getting plucked like a few times. And like I'm not someone that's like super scared of needles or anything like that. But I feel like you're already just so during chemo, at least in the later stages, like you're already like so predisposed to being nauseous that like I think your body has like a natural like nausea response as like a way of trying to tell you to like stop what's happening right now. And I remember like feeling like I could puke a few times, like every time they were plucking it in. Actually, I remember one of the nurses saying, like, I've never seen anybody here that's like gotten that many tries without like vomiting or like, at least needing a second to relax. So yeah, I recommend. I mean, I guess from my perspective, probably just because of the sepsis situation, it makes me appreciate, I guess, how dangerous the infection is. But I think Dr. Einhorn's advice, at least for my scenario, kind of kind of made sense in the long term. It was just, it was just kind of frustrating sometimes. Like I remember my last couple of days of chemo being genuinely worried, like how are they going to get the chemo in me right now? There's no veins anywhere, but they figured it out. They got some ultrasound stuff and all to help with that.
So let's talk about now you finished chemo and then you had your post chemo CT. Was this when it showed like the lung nodules had gone away and then was there still residual in the abdomen?
Yeah, so I think my abdomen tumor went from like 8 or actually no, I think it was like 12 centimeters, maybe down to like 7 or something, at least on the long side of it. So it had significantly shrunk, but they had known from day one. I think they told me like there's a 95% chance you're gonna have to get an RPL&D. Like there's a pretty low probability that your tumor is gonna, shrink enough to where it's not concerning. So kind of had been mentally preparing for that. So we did the CT scan, and then I think so. I think I finished chemo like I want to say like early December, and then I ended up having the RPLND with Dr. Carey, who you've had on the podcast, who's awesome as well.
He did mine, so
Um,
he had his hands in both of us.
Oh yeah, yeah. It was funny. Maybe it was you, but I posted my scar after, and it's pretty impressive, like how relatively small like the scar seems. And somebody commented on my picture and was like, "Oh, like that looks like Dr. Carey to me, a modern day Picasso." And I was like, "Oh, that's hilarious."
That
He's
wasn't
an
me, but that's
artist.
funny.
Yeah. Um, but yeah, he did my RPL&D. And yeah, the RPLD was rough. I mean, chemo to me was harder than the RPLD, but the first like 40 or 24 hours probably was like, no, not fun. But yeah, I mean, it was the best of news when he came in after the pathology, I think like 48 hours after the surgery, um, and told me that basically it was all scar tissue. So there's no like teratoma, no residual cancer. So, I mean, that was kind of the best news that I could have got. And I guess as of that day, I was now officially in remission. I guess is how I looked at it at least. So yeah, I mean, in a lot of ways, things went kind of as smooth as they could, and like residual effects from the chemo. I didn't really have like a lot. Like I know some people have like neuropathy. Like obviously, I had like chemo brain for a little bit and things like that, but I feel like all in all, I kind of made it out a little bit lucky in that sense. And the RPLD, I did have, I'm pretty sure we've interacted on the testicular cancer Reddit about it because I had like a ton of back pain after. But I think what happens with the RPLD is apparently it's pretty common to have lower back pain. I'm guessing just because your abdomen muscles are like shot for a little while, which puts a lot of load on your back. Um, so yeah, I'm like finally getting out of the other side of that. I think I was just predisposed to back pain, lower back pain going into it. So I was like one of the 20% that kind of does get that back pain. So there's a bunch of things that I've tried. Dr. Carey was like big on acupuncture, I remember. So I'm actually still doing acupuncture, which helps a little bit. So hopefully for most people, even for me, it felt like it was never going to go away for a while there, but hopefully it's temporary for anybody else who's experiencing that after the RPLD too.
For that acupuncture, is that something that you pay out of pocket for? Is like it covered by insurance since it's related?
No, so yeah, I get that covered by insurance. I found somebody that's on my insurance plan, and one thing I learned, at least for me, is I'm getting the best insurance my company offers from now on. So my deductible and all that good stuff is like pretty low. So it's like really reasonable. But I do know I was talking to one of my friends recently who does acupuncture, and she pays out of pocket, which I think is also pretty common. I've done acupuncture before all this and paid out of pocket too. I would say it's worth it, but I'm like a believer in, everybody's solution's different. And sometimes it's someone like me who's like a Frankenstein of a bunch of different solutions where like I've tried surgery, PT, chiropractor, I've done a ton of different things like injections. I've even done like pain therapy, which actually is what I've done like most recently. That's probably like helped them the most. It's like there's some science behind like neurological, like almost like learned pain. It's kind of a weird concept. It took me a while to get around my head around, but I think that's been helpful too.
Interesting. Wow.
Yeah.
Okay. Yeah, it's funny in the insurance thing you mentioned too, like trying to always get the best offering. Yeah, I do the same thing. My wife's
Yeah.
like, we should get the HMO, it's cheaper. I'm like, no, I need like the PPO so I can go like to the experts when I have something like that, that I need to see an expert
Yeah.
for.
Yeah. I remember there was like one funny, I had also like signed up for critical illness. Like I, I mean, it was nice that I did that, but like I don't remember doing that at all. I think I was paying like $1 a month. And I actually found out about it like right as I was finishing chemo. And it was like basically like a $10,000 payout. So I was like, oh, this is great. And I'm sure the person on the other end of the phone was like kind of confused because I sounded like almost so happy to like tell her that I had cancer. Because I remember there was like different tiers. Like if you had like stage one, like it hadn't metastasized, you would get like $2,500. And she was like, "Oh, did it spread?" I'm like, "It's all over." And she's like, "Great, and you get the $10,000." So yeah, I mean, having good medical benefits, like, and like I said before, like my company actually paid me through, which was like not expected at all. So I was pretty fortunate in that sense that I didn't have like a lot of financial pressure, and there was Fairhaven, that nonprofit that Jay's wife, that Jay, Dr. Einhorn's nurse, his wife actually either volunteers or works there. So that's how I had found out about it. And a cool thing about that, actually, I did like I always remember when I was there, I was like, I want to like pay this place back because I had stayed there for like 2 months, and I was always on the fence about like posting on social media about things. So I didn't really like do that. I'm not like huge into social media anymore. But eventually I was like, no, I'm gonna announce my story. This is like after like 4 months in remission, and I'll also like ask for a fundraiser for Fairhaven. That way, like something good comes out of it. And I was also thinking like hopefully somebody reads this and like tells somebody or checks themselves, or like ideal case is somebody catches something early because of this post. And we like raised like $5,000, which was cool for Fairhaven. So I feel like that paid my stay at a minimum. And then what was even cooler is like one of my coworkers actually reached out to me on LinkedIn, where one of the platforms I posted on, and told me that because of my post, he went and got checked, and he actually caught it in stage one. So the post was worth it.
Yeah.
But yeah, now I'm like, I've had a lot of friends who have gotten themselves checked out, just knowing what happened to me. So I feel like, had I known, I probably would, I don't know how much guys are like really taught to check themselves like once a month, like you're really probably supposed to. I mean, I was never checking down there for cancer ever. But had I been like doing that actively, like I think women do typically with their breast for breast cancer, like maybe I could have caught it earlier too. So yeah, I feel like awareness is one that we don't have a cure, but awareness is pretty darn close for testicular cancer, I guess.
Yeah, and that's what TCAF is all about, early detection. And that's great that your friend caught it at stage one. Which stage were you? Were you three with the lung metastasis, or?
Yeah, so I think I was three. Like, I guess there's three A, B, and C. For a while, I thought I was three B, but I guess technically because my HCG was like concerning, I got labeled as three C. But I think when I was reading online, and it's still like a gray area for me, I say it's three C just because that's what I was told. But I think typically when I read online, it's like three C is if it spreads to organs like the brain or like the liver, I think. And I think that's when things get pretty serious. So yeah, I mean, for me, like I knew kind of early on, like half or at the end of my first round, that like I'm probably going to be okay. But because I saw this, cliff on a graph, they showed me this graph of like 380,000 to like 2,000. I was like, okay, it's working. So I was pretty lucky there. But yeah, for like a little bit, I didn't really know what the outcome was going to be. You don't really know it's going to work until you start seeing some results. So it from then on, it was less of a mental struggle and more of a I just got to get through this struggle, which is harder in some ways, but easier in a lot too.
Yeah, so let's go back to the RPLND. So you had the 7 centimeters, which ended up being just scar tissue, but you did go to a high volume center. So what was Dr. Carey kind of saying going into it in regards to like the possibility of retrograde ejaculation and things like that?
Yeah, so that was like definitely a risk for me going in. One of like the risks that was a lesser risk but still a possibility, that they had talked about, was like the possibility of losing my left kidney, just because my tumor kind of like, I think this happens with chemo, at least for testicular cancer chemo, where you like your tumor kind of almost like fuses around your muscles and things like that, like is at least how it was described. So I think it kind of makes it harder to remove. So I think that made it a little bit harder for them to maybe, they might not have been able to spare my kidney and keep it in there because of that. And same with the nerve. But I was pretty lucky again, where I didn't have retrograde ejaculation. Even if I did, I also was lucky that I banked sperm before. That was like one of the first things they were like really pushing for me to do. And when you just got cancer and you're like feeling terrible, you really don't want to be having to go to the sperm bank, but you just do it and you figure it out. So even if I had retrograde, like it wouldn't have been, I guess, like the end of the world. Like, because I do want to have my own kids one day. So, but I still have the sperm bank kind of as a backup option. But I'm actually like going through fertility testing now. Dr. Einhorn said it's like sufficient enough time to get a decent idea of like where my fertility is at. So I just had I met with a doctor for the first time yesterday, actually, just to get that ball rolling and like figure out where I'm at. Because it's kind of hard to tell. Like I had banked my sperm and like my motility and all that was like really, really low. But a lot of times, according to Dr. Einhorn, at least that's like common for while you have the cancer. So that sometimes I can come back, but obviously this type of chemo is pretty tough on the body. So there's still a chance I'm no longer fertile, but hopefully even with the not optimal sperm that I banked, I think all it takes is one with the technology these days. So I'm still hopeful that I'd be able to have my own kids, and if not, then whatever kid I end up having, whether I adopt a kid or have my own, like my perspective is like I was meant to be my kid. So still a little ways away from that, but it's still something like testicular cancer, all this experience, like it forces you to have these thoughts and conversations with my girlfriend and things like that. So, which I guess in a weird way I'm like fortunate for.
Yeah, I think I never like said the word testicles, or I definitely never said the word sperm so much
Yeah,
before.
yeah. Who would have known we would learn so much about our nuts? It's actually wild, like how much in retrospect I feel like I've learned about just even cancer and like the history of how chemo became a thing, and it's all actually kind of fascinating in its own right. It kind of makes you appreciate like all the research that's going on. It's crazy, and all the people that work in the hospitals. Like, man, those jobs are tough.
Yeah.
I don't envy that at all.
So you talked a little bit about the sepsis. You said it was from like a leakage. Was that the lymphatic fluid that was leaking?
Yeah, yeah. So I know that's like common, like where a lot of people go on the what is it, like the low fat or no fat diet because of
Hmm.
getting some lymph nodes removed. Um, Interestingly, IU was not like super intense on that diet, but they did have like they did recommend some things. They just weren't as like stringent on it. I remember them telling me like, oh, after 4 weeks, you don't have to worry about it so much or anything. So I tried to follow that diet, but I kind of also followed their advice that I wasn't like super super strict about it. But I'm pretty sure the fluid that I got wasn't like that. I think it's more of like a milky colored fluid, and the fluid that I had was like a different color. It was more like transparent. So I think it was just, I don't know, lymphatic fluid that was not related to, I guess, like me dieting poorly or improperly, or at least that's what I tell myself. So I think what happened was like I was having a lot of like my psoas muscle down because that's where my tumor was kind of hugged to. Like I was having psoas muscle, hip flexor pain, back pain again, and they basically did a CT and noticed that it was like pretty basically where the tumor was. It just filled up with fluid. And it was pretty uncomfortable. So they kind of like gave me the option, like, we could drain it or we can just leave it and see what happens. In retrospect, I wish I just left it. That would have saved some headache. But yeah, instead I opted for the drain. And they basically just poke a little hole in your back and you just have a drain walking around with all day. And I mean, it was fine for a while, but then I noticed like the drain wasn't really like draining much anymore, which I at the time thought was a good thing because I was like, oh, it's running out. But it apparently meant that I had an infection, and I mean, that infection came on so fast where one moment I remember my girlfriend and I, it was like a Saturday night, and we were just like having a low key night. I remember we were like debating getting ice cream or not. while we were watching a movie, and uh, we decided not to. And I was like, I'm getting kind of tired. I'm going to take a nap. I took a nap. I woke up. I tried to go downstairs because all of a sudden I'm like super thirsty, and I'm like in and out of it, like walking down the stairs, like kind of yeah, just totally like foggy out of it. And yeah, we went to the ER, and what I thought was just going to be like an overnight stay at most ended up being like a 7 day stay because I had to get like intravenous antibiotics and all that stuff. So yeah, I remember they like it was kind of scary because like sepsis is once I started researching it, I was like, man, this is like actually like unfortunately a lot of people die from that. But luckily, I mean, I just took my if there's anything I learned from testicular cancer, it's say when something's up, get help right away. So we caught it, plenty early enough, I think, where it wasn't like a huge issue. But yeah, I mean, I was also kind of fresh off of chemo. This was actually like almost exactly a year ago. So I was only a couple months out of my RPL&D and a few months out of chemo. So my body wasn't already great going into it, and it took like a month or two to kind of fully recover from that, I think.
Jeez. Did you get ice cream at least to celebrate when you got out of the hospital?
I'm pretty sure my girlfriend brought some ice cream at one point when I was in the hospital because that's the easiest thing to eat. And also, I ate a lot of ice cream during chemo. I remember like originally I was like, I'm gonna be so clean with my diet because I feel like I was thinking like, oh, this must be like because I wasn't eating healthy or like I kind of was like, eventually I've kind of come to terms with the fact that like there's not really a whole lot of explanation out there besides like having an undescended testicle when you're a baby, or there's a couple other factors like genetic factors. But like at first I was like, oh, this is my fault because I wasn't healthy or whatever. So I'm gonna eat like super clean. And then once the chemo nausea came in, and my nurse also gave me permission. He was like, dude, you're just trying to have calories. Like, don't worry about, eating green right now. So yeah, I ended up eating a lot of ice cream during chemo, so it got me through.
So you gave a lot of great advice in your submission. So I'm going to ask you, what advice do you have for guys who are going through it or have just started or they're just fresh out of it?
Yeah, for sure. I think like for me, I actually kind of struggled once I got on the other side of it a little bit, where I felt like I was supposed to have this like newfound perspective on life kind of thing. Like, oh, I'm a cancer survivor, so now I got to be like everything's got to be clear and to me and everything like that. And that wasn't really like my experience, and I also felt like, oh, like maybe out of cancer I'm gonna like do some, I'm gonna have like things are gonna be clear to me, like I was saying, on like, oh, this is what I should do with my life and whatnot, and I should do my life completely differently, live in the moment, that kind of stuff. And it turned out like I was like, and I actually went to like therapy after chemo because it was just like, kind of traumatic experience. And like, we only did like a few sessions, but one of the things that came out of it for me was like I did a values assessment. And like a lot of the things that I valued actually were kind of aligned with exactly like how my life was before cancer. So for me, I kind of, instead of like trying to like start a new life after cancer, I actually just wanted my old life back, basically. And to me, I'm like pretty happy with that. So not a lot of things have like totally changed. I'm still in the same job, still the same friends, living in the same city. But to me, that's like I'm just like grateful for that. And in the back of my head, I still go through the day-to-day annoyances, and I want to be perfect and like keep things in check. But um, at the end of the day, like sometimes I do forget like how lucky I am, and I try to keep in the back of my head and keep in perspective that like anything can change in snap of a finger at any moment. So just try to enjoy the days on a day-to-day basis. And for anybody that's getting through it, it's brutal, but I think, and luckily for us, like a lot or most cases, like you will get out the other side. It's kind of the only way it's through. So yeah, it's a tough chemo regimen. RPL&D is not a great experience, but like it's the necessary one in order to really move past things. And there's a reason why they give you a lot of the chemo is because it works. I'm sure you can relate. It's like you just kind of keeping that mental strength throughout is just like paramount. I think you'll be happy to kind of know in the back of your head that you will get through this. It's just you got to just take it one step at a time, and eventually it'll be in the rear view.
Amazing perspective. Thank you for sharing.
Yeah.
Is there anything else that you want to add that I didn't ask about?
No, I don't think so. I think we covered a lot. Yeah, we covered the cancer, the tangentially related stuff, and all that. So thank you, man, for having me on. It's been fun to kind of talk to somebody who can relate on all this stuff.
Yeah, and I know you said you're not big on social, but can people find you anywhere? Or I know you said LinkedIn or Reddit. I don't know if you want to
Yeah,
give your Reddit name out.
yeah. I honestly forget my Reddit name, but maybe I know you had a post from a while ago asking if people wanted to be on the podcast, so you can find my name there. Also, yeah, you could find me. Like I have a LinkedIn. I also have a Facebook, so I do have a social media in that sense. So if people want to reach out on either of those forums, happy to talk to somebody. But honestly, like I feel like I was able to really also just get community from Testicular Cancer Reddit, and I still hover posts there and offer insight when I can.
Cool. Trent, thank you so much for being on It Takes Balls.
All right, thanks, Steven. Appreciate it.
For more information and resources for your testicular cancer journey, visit testicularcancerawarenessfoundation.org. You can also follow us on social media at Testis Cancer. We're on Facebook at Testicular Cancer Awareness Foundation.